Hello, I'm Dr. Swan at In-Home Psychiatric Services. Today, we're covering one of the most widely prescribed and frequently misunderstood psychiatric medications, Seroquel, also known by its generic name, Quetiapine. This medication is used across many diagnoses, from schizophrenia and bipolar disorder to depression, insomnia, and dementia-related agitation. But is it always appropriate? Let's take a closer look. Seroquel is FDA-approved to treat schizophrenia in adults and teens, bipolar mania and bipolar depression, major depressive disorder, as an add-on therapy. It works differently depending on the dose, high doses for psychosis, moderate for mood stabilization, and low doses for anxiety and sleep. That range explains its popularity, but also why it's sometimes overused. Quetiapine affects dopamine and serotonin receptors, but it also has strong antihistamine properties. That's what causes the sedation, even at very low doses. It's important to remember, it was not originally designed as a sleep aid, but it's often used that way. Let's go through some of the most common clinical uses, and what the research shows. Schizophrenia. Quetiapine is effective and well tolerated, especially for patients who are sensitive to movement-related side effects. However, it's usually less potent than risperidone or olanzapine, and its sedating effects may limit daytime use. Bipolar disorder. Unlike many antipsychotics, Seroquel is approved for both manic and depressive phases. It's particularly valuable for bipolar depression, a difficult symptom to treat. But keep in mind, it comes with significant metabolic risks, including weight gain and elevated blood sugar. Major depression, adjunctive. In lower doses, Quetiapine helps with anxiety and insomnia when added to antidepressants. But side effects like sedation and weight gain may outweigh benefits for some patients. Autism spectrum disorder, ASD. Though not FDA approved, Quetiapine is used off-label for irritability and aggression. It's less likely to cause tremors or prolactin issues than risperidone, but it tends to cause more sedation and appetite increase. Intermittent explosive disorder, IED, used off-label in certain cases to reduce severe outbursts, especially when SSRIs haven't worked. However, it's not first line and requires close monitoring. Sleep disorders. Low-dose Seroquel is often used for insomnia. It works, but this is an off-label use, not supported by guidelines. Over time, patients may become dependent on it for sleep, without addressing the root cause of their insomnia. Dementia-related agitation. Seroquel is commonly used in long-term care settings for behavioral symptoms. But there's a black box warning. It increases the risk of death in elderly patients with dementia-related psychosis. That said, it's sometimes preferred over risperidone or olanzapine because it causes fewer tremors in Parkinson's-type dementias. Let's talk safety. Seroquel carries several serious warnings. Increased mortality in older adults with dementia-related psychosis. Higher risk of suicidal thinking in young adults. Potential for severe sedation and low blood pressure. These risks mean Quetiapine should be prescribed carefully, especially in medically fragile patients. When a patient is on Quetiapine, here's what should be monitored: weight, blood pressure, and blood sugar. Cholesterol and triglycerides. Sedation and fall risk. Behavioral changes or worsening mood. Ongoing labs and clinical observation are critical, especially in long-term use. So, when is Quetiapine the right choice? It can be a powerful tool in the treatment of bipolar depression, schizophrenia, and some severe anxiety or mood conditions. But it's not a casual sleep aid, and it's not appropriate for every case of agitation or insomnia. Good prescribing starts with clear goals, ongoing monitoring, and informed consent. Seroquel is effective, but not without risks. If you have a patient on Quetiapine, and you're unsure if it's the best fit, reach out. We're here to help you make the safest, most informed decisions for your patients. Thank you for watching, and thank you for the care you give every day. In-Home Psychiatric Services comprises a dedicated team of professionals, including psychiatrists, psychotherapists, psychiatric nurse practitioners, advanced practice psychiatric pharmacists, and clinical social workers. Each member is committed to providing compassionate and personalized care to individuals seeking help for their mental well-being. Our services and interventions are grounded in evidence-based practices with outcome measures and genetic testing as needed, thus ensuring a high standard of care for our clients. Utilizing the convenience of telehealth through phone or video conferencing, we make mental health services easily accessible for all. We can be reached through the information listed. Thank you so much for your attendance and have an amazing day.